Start.
This is changing an adult brief with male perineal care and hand washing. First step of every skill is always going to be sanitizing my hands. I'll take my alcohol-based hand sanitizer and rub it all over my hands and wrists until it's dry. Hi Dan, my name's Jeanette. I'll be your nurse's aide today and I'm here to get you washed up. Give me just a moment to get my things. I'll be right back. I'm gonna pull his privacy curtain. I'll collect my supplies. I'm gonna need a basin of comfortably warm water. I'll need 2 towels, 4 washcloths, a waterproof pad for on the bed, and a bath blanket. I'm gonna need my gloves, my soap, and a new clean brief. Remember that when you are doing your skills, you can move anything anywhere you want to in the room. So, because I'm going to do my skill from this side so that you guys can see, I'm gonna move my trash and my dirty linens over to this side of the bed. Before I put my bed up and get going, I'm gonna put my side rail up. For our purposes, we have a PVC pipe side rail, which goes to show you that you don't have to have the actual supplies to practice your skills. I'm gonna raise his bed to a good, comfortable working height, which is gonna be mid-thigh to waist level on me. I'm going to take my bath blanket first and unfold it about halfway. And we're going to put it over Dan's top half. There you go, Dan. Don't want you to get cold. I'm going to pull his blanket and sheet down and fan fold them nicely. Your waterproof pad is going to have a waterproof side and an absorbent side. Make sure that the absorbent side is going towards your resident. I'll roll it roughly halfway so it's ready to put underneath of him. I'm going to pull his gown up just for a moment so that I can, come over here, so that I can get his brief off of him. And I'm going to take the side of the brief that is away from me and make sure that I tuck it underneath of him. Okay, Dan, let's roll over towards that side rail. Make sure that I keep you covered as best I can here with your bath blanket. Go ahead, remove the brief. Oh. And it's going to go in my trash. Okay, now we're all set up and we're ready to provide some perineal care. We're gonna make sure that we're only exposing his perineal area. Don't mind, Dan is a amputee here. Once you take a washcloth out of the basin of water, you never put it back in. So make sure you get it out and squeeze it out. We'll add some soap. I'm gonna take my washcloth, I'm gonna fold it into half and now into quarters. You need to be sure that you're always wiping away from the urethra because you don't want to give Dan a UTI. And you need to make sure that you're using a clean spot on the washcloth for each wipe. There are going to be 4 wipes for a man's genitals. First step is going to be grabbing around the shaft of the penis. You're going to make 1 wipe around the head of the penis. Don't go back and forth. Keep going in one direction. So this side is dirty. I'm gonna flip it over so I have a clean side. I'm gonna cleanse down the top half of his shaft away from the urethra. Now I'll flip it in half so I have 2 more clean sides. Third wipe is gonna be down the bottom half of his shaft, there again, away from the urethra. And finally, with my last clean side, I'm gonna cleanse his scrotum. This will go into my dirty linens. Clean washcloth, no soap, we're rinsing now. Fold it in half, then into quarters. Grab the shaft of the penis, 1 wipe around the head, clean spot for down the top half of the shaft, flip it in half, down the bottom half of the shaft, and with my last clean side, I'm going to rinse his scrotum. That'll go into my dirty linens as well. And you know you don't wipe dry elderly skin, so we pat, 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 pat. Flip it over, pat, 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 pat. Flip it in half, pat, pat, pat. Flip it over 1 more time and dry the scrotum. We'll go ahead and cover your front half there, up there, Dan. Go ahead and roll back over towards that side rail for me, my friend. Hold on there, Dan. Third clean washcloth. We'll put soap on it. Fold it into half, then into quarters. Everything that we wash as far as any of our perineal care skills, changing an adult brief with male perineal care and hand washing, female perineal care with hand washing, or catheter care for a female with hand washing. Everything except for the penis is always going to be 3 wipes. The penis is 4. So now you're going to want to clean from the scrotal area away up past the anus. So you're going to do 1 wipe up the middle, flip your washcloth over, 1 wipe up one side, flip your washcloth in half, 1 wipe up the other side. Whatever you do, don't ever go back down. Don't ever change directions with any of these wipes that you're doing, because that could be considered contaminating and that would fail your test. Put your washcloth in half, then into quarters. Up the middle, flip it over, up one side, flip it in half, up the other side, into my dirty linens. If you're flipping your washcloth and you get confused and you think, did I flip it too many times? Do I have a clean side or a dirty side? Simply tell your observer that you're going to restart and from the beginning because you got yourself confused. Call yourself out and restart it and get credit. We're gonna take our towel and we're gonna pat his bottom dry. Pat, 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 pat. Flip it over. And then finally flip it in half into my dirty linen. While I have him on his side, I'm gonna go ahead and get the new brief started. We'll tuck this part underneath of his hip. And a good rule of thumb to go by, see the blue rectangle here? If you line up the back side of the blue rectangle with the bottom of their buttocks, that's gonna help to get it properly positioned. Okay, Dan. Straighten your leg out there, my friend. Roll back towards me. Fasten the tabs. The tabs should, of course, be on the back. Okay. On this side. Perfect. Okay, Dan, roll back over towards me one time. And I'm gonna roll this pad back underneath of him because I want to remove it and I don't want to create any friction when doing so. Back towards that side rail one more time, Dan. Perfect. And that will go in my dirty linen as well. Bath blanket into the dirty linen. Make sure you're straightened out and looking good there. Wonderful. Okay. I'm gonna come over here and take care of my person first. I like to do my steps in the same order. So I always like to make, and that's gonna help you to create muscle memory. And that's also gonna help you to not forget to do something. When I'm out in the real world, I'm probably gonna wanna take my gloves off, rinse my things off, take my gloves off, or maybe take my gloves off and then put more gloves on before I rinse things. But for my state test, I'm just going to leave my gloves on and take care of my person. That way I don't forget to give them their call light or something. Take my side rail down. My bed's back down to a safe height because we don't want to fall. Is there anything else that you need, Dan? No? All right, there's your call light, my friend. I'm gonna open my privacy curtain. You can move anything anywhere you want, but remember, afterwards, you need to put it back where you got it from. Soap back in my supply area. Take my basin of water, and we're going to the bathroom. This is going to get dumped down the toilet. Rinse it out. Dump that down the toilet as well. I'm gonna dry my basin out because bacteria grow in or form moist places like when we store wet basins. Make sure that you're thoroughly drying it. You don't want to leave it wet because then you won't get your credit for that step. This is gonna go back right out here in my supply area. I will doff my gloves, making sure that I never touch the outside. They'll go into my trash, and now I'm gonna wash my hands. Get my hands and wrists wet. When you go to take your state test, they will have an automatic soap dispenser. Ours is empty at the moment. Apply soap to my hands and wrists. You need to be making sure that you get up onto your wrists about an inch or so past where your gloves end. They want to see you interlace your fingers while pointed down. Take your fingernails and scrub them on the palm of the opposite hand. And this whole time that you're scrubbing, from the time that you apply your soap and start scrubbing, not including rinse time, you have to scrub for 20 seconds at least. If you need to, sing a happy birthday song twice. Now I'm going to rinse my hands with my fingers pointed down because I want to rinse the germs down the sink rather than up my arm. Don't flick your fingers, that's half the battle. Immediately throw that wet paper towel into the trash. Get a clean, dry paper towel to shut my water off. If you shut your water off with the wet paper towel, that's considered recontaminating, and that is a failure of any hand washing skill. If you do something like that, or if you touch the inside of the sink or the spigot or something, you simply call yourself out and you say, I accidentally contaminated my hands, I'm going to start again. You apply more soap and you start scrubbing for 20 seconds again. And that is it.